Aiyana Davison. She is a certified nurse midwife as well as a women's health nurse practitioner, and she's here to talk to us today all about birthing during COVID. I know there's just so much anxiety happening right now for so many expecting women because, just recently in New York, there was that petition that went around because local hospitals there were saying no support person or partner could be in the room with the woman laboring. And I know we just had our third and she's now 11 months, and just thinking back to what just how emotional, like, it was my third baby, but it was the first baby I delivered vaginally, and thank God for my husband and my doula that were there to help and give me that support, because I think there were so many. Well, let's just kick it off. What should women, because I'm getting too much into talking about me and I just want to hear from you. What can women expect from when they go into labor? What should they be thinking about?
So I think support, just like you were talking about, support is one of the major things that folks are probably the most concerned with. We even have patients, they'll call in advance, whether it be the clinic, offices, email us, or even on the floor to find out, who can come in. Because, you hear all these rumors and different things, and different states and hospitals are practicing differently. So know that your support, as, some people come with 2 or 3 people, outside of COVID or pre-COVID, or they come with, maybe one person. And for a while, yes, there were some hospitals, mainly on the East Coast, from what I understand, who were restricting visitors at all. So, and it depends on your hospital guideline. It depends on your practice's guidelines. What I'm finding for the most part is, at least in the state of California and the hospitals that I'm affiliated with, we allow one support person in. So it's really important for people to know who can come and start thinking about, the preparation. Preparing for a pregnancy goes way beyond the time you conceive, but now we're in a state of there's so much more to consider. So if you have one support person, the other thing is some hospitals are restricting that support person from even leaving the room or the unit that you're on. So being prepared with snacks and, of course, your change of clothes, the things you would normally bring, but anticipating not going anywhere until you have your baby in your arms and it's time to go home. So support. And then also in terms of the normal ups and downs of pregnancies, the different complications, you want to know your numbers to call, of course, because we're really encouraging people, if you do not have to come to the hospital or even the clinic setting, if we can do something by phone or even, kind of manage or treat at home, consider that before coming in. So knowing your numbers of who to call and what's an emergency versus an urgency versus something that's standard. And that, if it's your first baby, sometimes you may not even know. And, even with more children, you get things that you're I never felt this before. So knowing who you can triage with and call with, or who you can speak with. The other thing, going back to the support part too, prenatal care or classes, many of those have been canceled if they're in person. However, we have this lovely internet that does so many things, and technology is so advanced. So I'm finding that either by doulas or some of the prenatal classes that are held in person, they're now transferring to a virtual method. And so that's definitely an option that, people can consider. So those are some of the major things to consider when you're going in or just during this time and you're pregnant, whether you're early on or you're further along in your pregnancy.
Right. Those are great tips. Now, going back to having the numbers on hand for additional support to call out to, what are some questions women should be asking their OBGYN before they get to the hospital? Because I know for me, I was trying for a VBAC, and I think my doula was really helpful in just preparing me in terms of asking my doctor how long could I labor before being induced was something we talked about. Mm-hmm. And thank God for her, because the first time we went to the hospital, the staff on hand put a lot of pressure on me to be induced right away. And I think if I didn't have that discussion with my doctor before and know what was safe for me and what I could push back on, I would have been very much persuaded to, because I felt scared, like all the things they were throwing at me, these like stats about what could happen if I didn't do exactly what they said when they said. But if I hadn't talked to my doctor about all of these like different scenarios and just prepare myself, I think I would have had a very different birthing experience than what I did.
Yeah. So there's quite a few questions you can ask. And of course, this is going to be patient specific or person, specific, individualized care. You do want to consider and talk with your provider about, yes, how long can I hold off at home before having to come in? And, you really want to be, let's say, no complications, what we consider a normal pregnancy. There's nothing really major going on. If we're just talking about contractions itself and the labor part, let's make sure you're hitting labor really, really hard. And what that looks like is preparing to do some laboring at home or in whatever setting you're in. And that might require doula support, which, you might be able to actually get. They're limiting how much, interaction they have, but you may be able to get a little bit of support at home, either virtually or in person, still while slightly social distancing. And someone can kind of help you get and hopefully get you into active labor. If a person, and how do you know this without checking, but also your body tells you a whole lot. Like if these contractions are coming every couple of minutes and they're increasing and they're strong, painful, and you can't take the pain anymore, you're starting to feel pressure, those could be signs that you're going to be close to that active labor phase. And maybe it's a chance to go in. And again, certain facilities will have a number you can call, and maybe there's a nurse advice line, and they can kind of review with you the things to consider. When you're talking about your bag of water being broken, again, I'm hospital-based, so this is going to be based off of the hospital guidelines and how we practice. Usually, if it's GBS or group beta strep, that vaginal swab that they do around 35, 36 weeks, if that's negative and the color of the amniotic fluid is clear, you're not seeing like yellow, brown, green, and you're feeling your baby move, maybe the contractions haven't started quite yet, you do have a little bit of time before you need to go in. And I'm not saying necessarily to wait for contractions to ensue, especially if there's, in the absence of movement from your child, you definitely should come in and get checked out. But again, this is kind of like ideal setting, no major problems. You could consider staying at home for several hours before coming into the hospital. Would I recommend pushing it to 24 hours? Not necessarily. However, it depends on your birth setting. So if you were to deliver at home, you're going to be at home anyway. So, or if you're going to a birth center, whoever you're in contact with, that midwife or that birth worker is going to say to you, okay, this is when I want you to come in, or let me listen to you, talk to you, see where things are. But in terms of like your bag of water, you have a little bit of time. I'm trying to think of what else. Yeah, so those are some of the things you want to consider. Now, if you have complications, you have to have these discussions beforehand. So there are some people who have to or are advised to deliver at a certain place because of either their own complications or complications with the baby. Even with a VBACer such as yourself, again, paying attention to and kind of monitoring your contractions and seeing how everything's going is super important to where this process is headed. So just kind of being mindful of all of that. And, don't hesitate to check in. You have to use your voice to kind of check in and, say either something doesn't feel right, or I just don't know if this is how it's supposed to be, and ask your questions.
Right, of course. Now, if the hospital you're delivering at, if your partner or support person isn't allowed to be in the room with you, what does that look like? How can they be present, and who is your advocate?
So that's a great question. And honestly, an unfortunate circumstance where, and sometimes, again, we have to consider there's sometimes exceptions to the rule. Like maybe a person has one partner, but they have a few children at home and no one else to care for them. And so that requires that support person that was initially going to be there to be home. Oh my gosh, how cute. Hi, little one. I'm easily distracted. So, especially by cuteness. Hi.
No, you're fine. So I just woke up from my nap.
Oh my gosh. So in terms of your support, you may have planned even to have somebody with you, and for whatever reason, maybe childcare is an issue, maybe there's another, maybe your partner's tested positive for COVID, like this is the time we're living in, and if that's the case, they're not gonna want them to come to the hospital. So again, this technology has been amazing. It's not the most ideal, but at the same time, considering, we have the option of some virtual doulas. So if you can plan for that and look for those type of providers, or support people in advance, that's going to help out, when they come in. Now, it's hard to say what it's going to look like when you go in terms of nursing staff. Everyone is different. There's all kinds of personalities, and clear communication is key, and that's important. But your nurse might be your advocate. Your nurse might be the one who's going to support you through this whole situation. And if something's not working for you, you have the right to request someone else to help you with your care and to be with you during this time. This is one of the most critical times that a person can go through in their lives. And while I always say, like, in the grand scheme of things in life, this is like, a short piece, although it feels like forever. It's a short piece in this whole grand scheme of things, but it is also a very critical time and a very monumental time. It's a time where you get to connect with yourself in a way that you never, could imagine, especially as your first go around. So just having somebody available to kind of work you through this situation, and knowing that you have the right to say, I'm just not happy with this. Not that we necessarily want you to do what's like hospital hopping, but if your care isn't what you imagined and you vocalize that and no one's responding, you do have the right, and you have options to try to see if you can find other methods for care. So some people right now are looking for home birth midwives as applicable, because they're nervous about going into the hospital, and other people, they don't particularly care for their care, so they're going somewhere else for it. So those kind of things, you just have to consider and be aware of.
That brings me to a point I wanted to bring up. I have been hearing more moms talk about, exploring a home birth option. Can you talk about that? Because I feel like it's something that not a lot of people are too familiar with. I think that, like, questions of maybe how safe is it, and all of that comes up.
So before there was ever a hospital, people were still having births, and they were birthing at home or in whatever setting, was considered home. And so, of course, with technology and changes, there's been guidelines and evidence and things that are supported, but home births are appropriate. There are things that happen, and it's a positive thing. Like, I applaud it, that in birth center births, if you qualify, because there are certain guidelines right now, depending on who your provider is, you have to meet criteria. And also, whoever's taking care of you you want them to be doing their best work with you. And that's where, like, consultations come in. So So right now, a lot of people are nervous and anxious about going into the hospital setting, and that's completely valid. It's warranted. You're unsure of what's going to happen. That support person part that we talked about. And so with all of that, it's like, well, home is looking better. And there's been quite a rush. Like a few of the midwives that I know of, especially local area, are like, oh yeah, I'm getting an influx of calls. And just because you want it doesn't necessarily mean like you meet criteria for it. If you're high risk, and depending on what the high risk part is, it may not be an option for you. And then also too, outside and pre-COVID again, midwives take a lot of time to make sure they're like aligned with their patients. It's just like you hire somebody for a job, or you want to make sure that they are working well with you. So they take the time to kind of get to know the patients, and the patients that have been or clients that have been working with midwives before all this, they've had this time to build a relationship, to build rapport, to get to know one another, to sometimes become like family, and not to discredit anybody, but then we have a rush of people who are like, I want this because I want to feel safe. And being upfront and honest is key. Number one, like, state why you're here. Like, I don't want to be in the hospital. That's a real thing. So here we are. Or this is what's scaring me. And, if they can get your records and review, because that's another important factor. We have to have your records, because otherwise you're leaving them kind of in the dark, and that could be risky and cause some complications. It's really important to be open and honest and upfront so that the midwife can still provide adequate care for you. These are still happening. So midwives are still, the home birth midwives are still taking on clients who they've just met, maybe even at 35 weeks. And so it's kind of this like fast track towards it all, but it's still a safe and viable option. And again, a knowledgeable, well-prepared midwife isn't going to let you sit at home and do things when they know there's danger. They're going to, transport you to the hospital or transfer care. So all these things you want to keep in mind too. I'm trying to feel out if I answer the question. Hopefully.
You definitely did. And then going back to that point of not every person, that's not a viable option for every person. Mm-hmm. So if you are in the hospital, you mentioned you do have that right to say, I'm not happy, I'm not being heard, I'd like to switch and have someone else come in. How do you have that conversation, and what are you allowed to say no to? Because I know from my personal experience, I very much felt like there were things I couldn't say no to, but because I've had extensive talks with my doctor, I knew exactly like where I stood within certain guidelines and could stand up and say no. But not every person, I definitely, like my first two babies, I definitely would not have been prepared in the same way. And I think I would have been swayed in a certain way, feeling like I was making the wrong choice if I didn't listen to what I was being told while I was at the hospital waiting for my doctor.
So, sorry, to backtrack, your question is how to have a conversation of switching like a provider. So, and that goes into something, it can happen even during prenatal care too, but we'll talk specific to the hospital. So, again, we have to recognize personalities and situations. And while we would love for not everyone to bring in their problems with them to work, this is a high stress time. Changes are happening rapidly, even by the second. There's a lot of meetings, there's a lot of updates, there's a lot of guidelines changes, and so with all that adds on another layer of stress, but that doesn't negate the fact that you can most certainly switch or ask for a different person to care for you. So it can look like simply saying maybe being repetitive about your questions. So let's say there's a communication breakdown. Okay, so what I'm hearing you to say is da 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 da. And if you're not feeling like this is flowing well, or you're not getting the answers you need, you do have the right to say no. Like, we are offering our medical advice, and it's based off of, we hope, I can only use, myself and practice that I work for. We hope that it is based off of evidence and supportive measures that we've seen and what we know works. And, birth is straightforward and complicated all at the same time. And so we really want to make sure that you're understanding everything that we're talking about. So if you're not understanding that and you're repeating your questions and you're still not getting answers, it is okay to say, okay, stop, or no, I don't want this intervention at this time. I need time to process it. Asking, number one, is your baby looking okay? Is my baby in danger right now? Am I in danger right now? And if the answers are no to that question, then you should have some time to consider some options. I think there's a lot of fear-based decision making sometimes in the hospital system, as opposed to informed decision making. And so patients or clients will do things out of fear tactics, or, well, this could happen, and stats, which, the numbers can be true, but we shouldn't necessarily use that to manipulate a decision. And so you do get to say, okay, I prefer that intervention to wait, or not to do that. There's always what they call leaving against medical advice. And, there are points in which that looks okay. And then there's sometimes you're 7 centimeters, you have an epidural. You still, there's still opportunity for it, right? But another conversation you can have, let's say if there's issue with a nurse or staff, you can say, is it possible to speak with your charge nurse? Many hospitals will have managers who kind of round and, come in and check on the patients and ask them how their experience was. And if they weren't able to speak up before, during a critical point, and, they needed help at that time, they can speak up then and, kind of let their voice be heard, and hopefully changes will be made. But, asking to talk with a supervisor, charge nurse, and saying, I'm just not feeling as if I'm getting the care that I need, or the communication I need. Is there another way, or another provider, or another person that I can talk with, or share this experience with, because I really do want to make sure that I'm safe, but I understand, and that someone can communicate the way that I understand, because it's about you. It really is. It's not about us. And a lot of times we take control, and I say we because I am a midwife, I practice, and sometimes I have to pull my reins back and say, this has nothing to do with me. This is your experience, So I'm taking the time to just say, I really want to make sure this is a journey that I remember for the positive and not necessarily negative. And having these conversations early on will kind of guide you to where you need to be. If we wait it out, and you may not know, because sometimes it's oh, this turned into something that I didn't think it was gonna be. So if you didn't know and it's just progressing like that, okay, that's one thing. But if you can catch it early on and have these conversations fairly early, that should be helpful. So hopefully that answers.
Yeah, that's great advice. I think it really gives women just a base of what their rights are, and how to maneuver when they're not feeling comfortable, which I think is really helpful. Can we talk about, I guess when you get to the hospital, are you given a mask right away? Are you tested to see if you may be asymptomatic for COVID? How does it all work?
Yeah, great question. So again, this will be facility dependent, but what I'm finding is screening is happening before you even hit the hospital doors, or walk into those doors. So you have someone outside who's taking the temperature of folks and asking them, are you having any symptoms? Have you been exposed to anybody or live with anybody who has had symptoms or tested positive? If so, you might be pulled to the side. And again, it's to your benefit to be truthful about these things, because and I'll get to the screening part for admission, but we want to know so that we can actually give you the support that you need and give you the care that you need. As well, we want to protect our staff too. Like, again, the experience is yours, but we also don't want to spread infection, so that we still have the staff and providers available to take care of people. So you'll probably, and I guess this is a really good like scenario to play, because I've experienced quite a few patients with high anxiety recently, because the changes, it's so different. So what does it look like when you go to the clinic or the hospital? Someone's gonna screen you, like I said, temperature at the door, ask you those screening questions. You may or may not be given a mask. So some facilities are handing them out. Others, and right now, I think it's national, but for sure I know for the state of California, we're required or recommended to wear a mask outside. So most people, if they don't already have their own N95, they have their own like homemade mask. That's, that's appropriate for right now. Not everybody has access. So you'll have that mask. You might be given hand sanitizer when you come through the door. Hospital-wise, you'll go up to your unit. Now, some facilities, depending on how large or small, you might be streamlined through the ER. So again, be prepared for that. Keep your distance. Like, you've probably seen like the little notations or the markations on the ground where 6 feet apart is. Just be mindful, because, as much as it's on our minds, we forget because we're in our own routine. So I even found myself like the other day, I was like, oh, I'm standing awfully close to someone right now. And it's just out of habit, and because we're human, we're meant to be with other people. But so you'll get up to whatever floor you're going on. You'll probably, once you check in, be asked the same set of questions that you were asked downstairs. So get ready for a lot of repetitive questions. And it's not that we're not communicating with each other. It's that we want to provide the best screening possible for our patients and, again, our staff. So when you come in, some facilities like where I work, if a mom is coming in for any kind of complaint, they're coming up by themselves. We are trying our best to let them know you're not going to have a support person with you unless you get admitted. So your support person, unfortunately, has to stay in the car. There are other facilities who have like drive up like screening. And so like maybe a provider will come out to you and ask you about your complaint, determine if it's something that needs to be seen or something that they can kind of manage, otherwise. And so if you're going upstairs, just know that, again, support person might be limited depending on whether you're staying or going. In the clinic setting, what's alarming, I think, for most people at this point in time is that you get up there, and because we've switched to a lot of telephone visits. So if you do have an in-person visit, it's going to be empty. In a busy practice where you see like people hustling and bustling, moving around, or you're in a waiting room full of like maybe 20 people, expect to see either no one at all or like one or two others. And again, this is for your protection. So I think that's one of the more alarming things, and I just like to point that out so that you can like mentally prepare. Like, things are going to look completely different than they did before, and it's okay. It's going to be all right. We just want to streamline the best way possible your care so that we don't have you so close to other people when we don't know their status. In terms of admission too, and I just wanted to touch on this before I forget, and a lot of people ask about screening. Do I automatically get screened? And so each facility, again, is going to be different depending on supplies of the screening tools used. And there's different testings or testing for COVID that we have. So there's a rapid test that we use at our job, and then there's a standard test, which comes back about 24 hours later. So if you're getting admitted and we're in active labor, or there's a need for you to have an imminent delivery, we will use the rapid screening for right now. And then if you have some time, let's say it's an induction and we know it's going to be a long time, or it's a pre-planned C-section, or scheduled C-section, when you come in for your labs, they also are screening you in advance. This is not every facility. I can only speak to like what my facility is doing right now, but these are some of the things you can expect.
That's great. And I think just knowing what to expect is helpful because you're able to wrap your mind around a little bit more and you're not completely taken by surprise. And I think that goes a long way in helping to ease some of that, those anxious feelings you might be experiencing. Now, what does recovery look like in terms of length of stay you're expected to be in the hospital, I guess both for vaginal and say a C-section?
Right. Great question. Again, I'll keep saying it, but facility dependent and dependent on provider. Right now, again, we're not looking to hold you in the hospital too long unless we have good reason. And for, again, a normal vaginal birth, or even like a TOLAC or something that went fairly well, no major complications, your baby's stable, those are the two things we now have to consider, you could get out as early as 18 hours. I'm sure there are some facilities that might be doing 12 with a follow-up, like maybe in a couple days for mom, and then your standard 1 to 3 day checkup for an infant. So vaginal delivery, no complications. Average time in a hospital, 24 hours, up to 48, depending on insurance and complications, like I said. Now with COVID or the coronavirus, as early as 18 hours, we try our best to get you out by the 24-hour mark, up to 48 hours still if there's issue. We're not, there's no rush to push anyone out. We want to be safe still, because the worst thing would be to send someone home to have to come back. So, again, even with appointments in the clinic too, going back to that, we design specific times for people to come in so that they're doing labs. Like if they have to do their glucose testing, they're doing that plus whatever else appointment at that same time. And then they won't be seen again probably for another month, but we'll call them for follow-up. And it feels very different. It looks very different. But then going back to the hospital. So for a C-section, they most likely could be released as early as 24 hours if they're stable, no complications. Probably minimum of 48 hours stay, just to be sure everything's okay, because again, that is major surgery. And infant-wise, you just have to make sure that jaundice isn't creeping in. The standard checks and making sure their assessment is clear. And if everything looks okay, then there's a possibility you can go home as early as possible. So that's what we're looking at.
Right, of course. That's great to know. Now, what if you or your baby test positive when you get to the hospital? What does that look like now for you?
All right. So again, like I said, we're screening our admissions, and you want to ask your provider if that's what was going to happen when you come into the hospital. So before we know these results, because they are going to take some time, we typically will either for sure mask up ourselves, and then maybe ask the patient to mask until we have results. If they come back and they're negative, great. We still will be using masks. For our protection. But it's hard to have a baby with a mask on. I've seen it, and like you're doing a lot of breathing and you need those deep breaths, and some people are prone to passing out. So for us, for the providers and the staff, they might have extra protective gear, because again, you can test negative now, and maybe a couple days later we retest and there's a positive because of exposure somewhere that we just didn't pick up. So we still want to just be cautious. And then also, if you test positive, that means we're doing a full isolation. So you may be in a room that has what it looks like visual. I'm a very visual person. So what it looks like is an isolation room. I know that sounds scary, but it's a typical hospital room. It just has a door that has a specific pressure to it, so that we prevent bacteria from flowing out to the rest of like the hospital or that unit. And and it has, you know, ducts and specifics, you know, vents and stuff. And then basically, you might see your nurse in like a full gown, a face shield plus an N95, and all the staff coming in should be prepared in that manner. So again, I like to be very real with my patients. Like, this isn't going to look normal. It's going to look a little sci-fi us coming in. But again, we want to keep you protected. We want to keep our staff protected. So we're all going to gear up and make sure we, you know, have the appropriate personal protective equipment on. And then you asked what it looks like. So many people ask about what happens to the baby if I test positive. Again, this is going to be facility dependent, and there's varying guidelines or recommendations at this time for this. I believe the World Health Organization is saying, you know, if a mom tests positive and wants to breastfeed, that she should not be separated, because skin to skin is essential in that first few hours, of course, but also breastfeeding provides like a level of balance for the baby and mom. So most likely they would have you mask up while breastfeeding. Some facilities are recommending that you're separated from your baby if you test positive. So that's something to keep in mind. And I just want to put a plug in here too. Evidence-based birth, if you follow them or go to their website, they actually have a consent for refusal of this if you really want your baby with you. I'm going to give my personal standpoint. Of course, this whole recording, this whole webinar here, I'm not offering medical advice here, and I'm not to be used as a substitute for your provider.
Right, of course.
But I just want folks to know, like, you have the right to be with your baby. I could not imagine going, and I get it. We are in this critical time of this virus. Again, changes are happening by the second. We're finding things out. The research is new. We don't know, how this is going to affect a pregnancy, although so far it's saying that pregnant moms aren't any more susceptible than anyone else. So there's that, but can you imagine being with this baby for the time that you've been with them, waiting for this day, and then being told you cannot be with your baby? I can't imagine that. Side note as well, you might find too that during a scheduled C-section that a support person might not be allowed in the operating room. Again, hospital guideline. So that's really frustrating. But I find that in hospitals where this is happening, the nurses are really trying their best to take the photos or be there with the mom as best as possible. Again, pending any emergencies or anything like that, and still provide an atmosphere where you get to connect. But I just can't imagine, even if I'm testing positive, being separated from my baby. This is my personal take on it. Like I said, every hospital is going to have their own protocols, their own guidelines for this. But some of the larger organizations are saying just mask up and then, try to keep distance when you're not breastfeeding, etc. And then if the mom is pumping, that's another option too. They can pump, and someone who is not positive or deemed not positive can offer that breast milk to the baby if they're in separation. So this is the reality of things. And again, it's scary. It doesn't sound amazing, but I think people want to keep the general population as safe as possible.
Right, of course. I think that was some really great information. What was that website again where they can find that consent form?
If you go to Evidence-Based Birth, they're an organization that pretty much does, they review the guidelines, and they go over like inductions. They also offer streamlined to your needs prenatal care virtually right now. So if you go to their, I know they have an Instagram page, and they have a website. They have that informed consent refusal form if you are not wanting to be separated. And then also they have some resources for COVID right now. So for patients and providers.
Right. That's great. Thank you for sharing that. Now, if you do test positive, are you required to wear the mask during active labor? Is that?
I would imagine so. For sure, you're going to notice that the staff is completely gowned up, but because you're testing positive and this is, airborne droplet, you're breathing, and birth gets real, like, it's real intimate. It gets real fluidy. Like, I'm making up a word right now. There's a lot of fluid happening, and so you're in the thralls of things, and so transmission is highly likely if someone's not protected. So they might request that you do, if even just a standard mask, not just N95, but for sure the personnel inside will be protected. They will wear, as long as they have equipment, they're going to wear that.
Right. So for the laboring woman, it's a possibility for her to have that mask on the whole time. But if she's not positive, or is it dependent on hospital?
Correct. It would be dependent on hospital policy. If she's testing negative, I would imagine that she doesn't have to wear the mask. Okay. But you'll still see staff coming in with their masks on, because we walk around with our masks on.
Right.
So she most likely won't, or that person most likely won't need to wear a mask during labor if they're testing negative.
Okay, that's great to know. And then if you do test positive, does your support person, are they still allowed in the room, or is that off the table?
I think, again, that might be something that is hospital dependent. If they're testing positive right now at the facility I work at, I believe the support person is still allowed in. And there's probably a high, if it's their partner, it's probably a high likely that they're positive too. So
right.
We're just going to be super cautious, But again, depending on the state and county and all sorts of things, hospital itself, there are some areas where, they weren't allowing a support person in at all. So find out beforehand.
Right. Well, this has been super informative. Thank you so much for joining us today. I think you gave us a lot of really great information, and just, talking about what it's like right now, so people can be prepared and wrap their minds around what to expect, and know questions to ask beforehand so they're prepared when they get there.
Yep. I'm glad it was helpful. I hope people will ask what they need to ask and have dialogue and prepare. Pregnancy, again, is all about or having a child is all about preparation. And I'm all about doing this way before, but who can predict a pandemic, right? So now that we have this information, it's kind of like, it's a little bit of a shuffle and a scramble, but also there are ways to get the answers that we need as best as possible, and to prepare as best as possible.
Definitely. Well, thank you so much again.